So I'd like now to go on to the final speaker of this session. And first of all, I just want to acknowledge Lauren Bellin, who brought forward this idea and has championed it. And I think it's something that's of importance to all of us, irrespective of what we're practicing and irrespective of our age. So I would like to invite George Matos to come forward and talk about reattaching the focus on body mechanics and ergonomics.
Good morning, everybody. How's everyone doing today? I want to thank you, first of all, for having me here. I feel quite privileged and honored to be here to share this time with you, and to thank once again Dr. Bellin and Dr. Turk for their time and their patience in a lot of my questions I was asking with the profession that you folks are involved in. Before I begin, I want to ask you one thing. Can everyone stand, please? And I'm just going to come over here. Now, as you're standing, I'm going to ask, can you place an item in your hand that you feel comfortable placing onto the floor? Anything. Preferably out of your own pocket, not your neighbor's pocket. So if you have that particular item, if you feel comfortable and it's not going to cause, and I apologize for the ladies and gentlemen wearing short skirts today, place that item onto the floor, please, if you so feel comfortable. Now, I'm going to ask you to pick that item up, if you please. Oh boy, we got a lot of work to do here. Okay, so you can have a seat again. So why am I asking you to do that? I'm asking because if we are having challenges in some of the simplest tasks, like lifting something up off the floor, that in itself lies where we have an issue with how our body functions. And before that, financial disclosure, I do not have any affiliations, so I guess I have no friends, which is fine. So let's talk about ability to move properly. If you were able to do something such as bending your knees, bending your hips, involving those joints to perform that simple task of picking up, that's great. But if I find that people are starting to do this kind of thing, we are now taking that path of least resistance. And if we have issues with our knees, issues with our hips or back, we are not effectively using our body as we should be. Yes? Hopefully. Today we're going to talk about, or this morning, about functional movement. So you may hear people talk about functional movement training or functional movement as it relates to exercise. So depending on who you talk to, different therapies or different backgrounds may define functional movement differently. Essentially, what we're looking at is something that's going to be practical and something that's applicable. So when we're talking about functional movement training, with the different hats that I wear, my personal training side may say, well, functional movement is the ability to stand on unstable surfaces so you don't fall. My strength side, my strength coach side may say, well, more importantly, it's functional movement to be able to do a proper chest press or a squat. Or if you talk about my therapist side, well, I can't get you doing any kind of three-dimensional movement without your rotator cuff properly functioning. So again, if I'm working with someone in the OR, perhaps I'm going to talk to them about being able to properly move their body from front to back if they're going to be assisting with the transfer of a patient. Or if I'm going to be training a firefighter, if their task is having to knock a door down, maybe we can do some functional movement training as it relates to hammering with a tire. But let's talk about what affects you folks here when we're talking about the factors, the risk factors associated with the job. When we talk about risk factors, there are a lot of risk factors. Number one we're going to talk about is awkward posture. What I've seen a lot in my observations, plus awkward posture. Awkward posture is essentially anything out of our anatomical neutral. So twisting, bending, kneeling, those kinds of things. We can always try to mitigate that risk. So as opposed to being in that forward flexed and position, we can try to widen our base of support and try to ensure that we're being really aware of how our body is positioned. But if we can't eliminate the risk, we want to try and mitigate that risk, which is really important as well. So let's talk about this. And one thing I'm really big on is sort of Eastern medicine, martial arts, Tai Chi. And for those of you who don't know about it, I really recommend Tai Chi is something that really gives you good body awareness, really truly helps you understand the limitations of your body and how to work within those limitations. So first of all, the functional movement patterns can be performed. Which ones can they be done? First of all, to mitigate that risk, awareness of body. First of all, is recognizing, do I have an inability to properly move myself? Okay, yes, because I understand this is my neutral and I can't function properly with that. So I want you guys to stand up and maybe be careful as you're doing this task. I really encourage you to try this. This is something we call serving T, and I don't want any eye injuries here, please. Pardon the pun. So what we're standing here, we call a horse riding stance. And if you can't see me, I'll see if I can pop up here quickly. Like my colleague Craig is doing there. He's in a horse riding stance, and we stand such as like such. I want you to hold your palms facing to the sky, both palms, and I don't want you to spill that tea. So as you're doing this task, you're bringing your arm across your body, slowly bring yourself across this way here. If you find restriction, don't go any further, come back, and keep working until that restriction is no more. The idea is to not spill the tea. So what we're working on is shoulder range of motion. The purpose of this task initially is if you have multiple attackers from the front and from behind, but I've been able to adopt this for rehab. And I think this is a great way to sort of work on basic shoulder range of motion. So if you're having a hard time with that, work on it. Before you do a talk, before you're doing your OR procedure, say to the patient, you're going to see me doing some funny things, but don't worry about it, it's all good, okay? So you can have a seat momentarily for that. Some of the other challenges, risk factors with your job, static loading and sustained exertions. I've seen some positions that some surgeons have had to maintain for 5-6 minutes like this. Now again, you're not going to stop the procedure because that wouldn't be realistic. But it's important to recognize that as you're doing that, okay, so as I'm doing this, I know I need to try and position myself or being aware that this is probably not good for me. So what can we do? There's another task I want you guys to try, again, if you please. So we're going to go into if you stand, we're going to go into a sort of a semi-lunge. So let's say, for example, if your left leg is back, you're going to hold your palms like such, okay? And you're going to, and please be careful if you have any back injuries. I don't want you guys to get hurt. So you're going to, left leg back, you're going to lean to the right and look over your head. So what we're trying to do is open up the anterior aspect of our bodies. Why? Because in almost every occupation, you see people doing this. We're always forward flexed. We're closed in at the front. We need to open up on that. Yeah. You can have a seat if you like. And if you're losing your balance, widen your base of support a little bit. If I can ask you, by a show of hands, who works on their fitness here? Oh, sorry, you can have a seat. These guys are like, am I standing? Am I sitting? Who works on their fitness here? Please, by a show of hands. Work on your fitness, exercise, if you will. I want you to keep your hands up. Oh, no, keep them up still. Keep your hands up if you work on your fitness and do specific tasks related to your job. You do? Can I ask what you do, or are you just stretching? Oh, perfect. So you work with the residents. So you create that environment that it's okay to actually take care of yourself? Yeah, perfect. I love to hear those kinds of things. And that's the mindset we need to start adopting, is that it's not just about performing the procedure. It's about performing procedures for the rest of your life, living outside of work. I was talking to a couple of residents yesterday, and I was asking them, I said, do you guys get any kind of formal training on injury prevention? And they looked at me with this, no offense, a dumbfounded look. Why would I get that? I'm focusing on what I have to learn to perform the task. But again, it's longevity, right? It's having a long-standing career without injury. So again, when performing certain procedures, there's that bending, there's that lateral flexion. We can try and mitigate by opening up our posture by having different stance. We have either a squared stance or a staggered stance, if you will. And of course, you know, if your feet are together, you're not having any base of support, but with a wider base of support, it makes it easier. The one thing I wanted to bring to attention here is that there's a lot of positions that we can adopt in the workplace that you'll see in the athletic field. So when I'm treating patients, whether they're someone working in the OR, a construction worker, what have you, at the end of the day, we look at patients like athletes, because you guys are performing your tasks all day long. You're performing your tasks for years on end. And the more you can be physically aware of how you should be positioning yourself, the more that'll translate into your workplace and effectively allow you to perform your tasks without, oh, this is just a part of the job, I just got to have a bad back. Or it's a part of the job, I have to have a bad neck. You don't. There's a lot of different ways that we can effectively help you guys reduce or mitigate those risks, if you will. Another risk factor, pinching, gripping. When you guys are holding on to your utensils or when you're holding on to your tools during your procedures. Yes? I've seen some pretty interesting things in terms of deviations, ulnar deviations, and the amount of gripping that's required. Now, one thing you can try to do is you can try to stretch your hand out. So by placing your hand flat onto your surface in front of you, Slowly extend and abduct, adduct your fingers. Put it flat onto the tabletop, so don't let your palmar surface come off, okay? And that's just a basic stretch that you can do. Can I touch your hands here, sir? He was kind of not happy when I asked if I can touch his hands. I want you guys to grab a partner right now. Doesn't matter, just the person next to you. Grab your partner's hand, don't be shy. Now, you're going to be holding onto your partner's hand with your fingers in the palmar surface. Okay? Don't be shy, gentlemen. Grab his hand. He's okay. I already asked him. That's a different kind of handhold, just like this. So you're just going to be massaging the palmar surface of your partner's hand. No. How does that feel? Does that feel nice? Don't be shy, please. Touch each other. It's okay. I want you to return the favor now. So why am I asking you guys to touch each other? There's a threesome over here. I love it. Perfect. You gotta like that. Who goes for massages here? That's it? Shame on you. I should see everyone's hands go up. Who goes for massages and doesn't just do one of these? Okay, work on my back. I want to see you guys get your neck massaged, not only in the back but the front. I want to see you get your palms massaged, your forearms massaged. Get the whole body massaged as opposed to the traditional massage that you get. Well, careful how I say traditional massage, but anyways. So the point is, think outside the box when you're receiving treatment. Think about what your tasks are that you're doing and how can I address those tasks from an injury prevention perspective. So can you guys spot the injury potential here? Anyone? Twist. Absolutely. It's amazing, these chairs, they come with little things called wheels. Casters, if you will. And the chair also has a swivel base. So as opposed to doing that, I'd like to see something more like this, please. Turn the whole chair around. If you're going to tell me that you are in a rush because you have patients waiting, because you have to hurry up, they're going to wait a lot longer if your back stiffens up on you. I need to get you guys thinking about that. I need to get you thinking about the simplest things you can do. Mitigate or eliminate, one or the other, the risk. I want to talk about physical activity really quickly here as well. The physical activity guidelines, we essentially need 150 minutes throughout the week of vigorous to moderate intensity exercise. Who does that here? Beautiful. Sadly enough, in 2013, just 2 in 10 adults to get the minimum requirements. 2 in 10, that's pretty pathetic. I want to talk about physical inactivity and its effect on bone. If you guys can look over here, we have essentially 14 subjects, okay? The 7 subjects at the top, they barely met the physical activity requirements as far as the 150 minutes, okay? Quite sedentary, actually. Individuals at the bottom over there, they met the top tier of their physical activity requirements for 1 year. You can clearly see the amount of damage that can be done, or the amount of the thickness of the diaphysis of the femur there on the top versus the bottom. Just from physical activity. It's not specific weight resistance. It's not specific anything. It's just making sure that we're moving vigorous to moderate activity. I have a question for you. How old do you think these individuals are here? Average age is 25 years old. 25. Our body is an efficient energy machine. We know that. If you don't use it, you lose it. Exercise, protein laying down, all that is no different. We need to make sure that our muscles, tendons, and ligaments get that stimulation that they need. You guys are quite well aware of the trans-theoretical model, right? Stages of change. Pre-contemplation, contemplation. Physical activity goals. I'm going to get you guys to think about something here for a moment. Do you, and you can write this down if you wish, do you have a personal physical goal? What is it? Please write it down. I want to see pens moving. Come on, folks. Work with me here. If you found what that is, what are you currently doing to achieve it? What do you need to do? And your barriers. I hear the biggest barriers are work. I'm too busy at work. You have no idea, George. I work 24 hours a day. Okay. Or I have children. My answer is I got 3 of them. Children are not an excuse, they're a reason to exercise. I really believe that. I really do. So what stage of change are you at? Are you not even thinking about it? Are you pre-contemplative? I got no time for that. Or are you contemplative? Yeah, you know, perhaps that might be something I might be entertaining in 5 years once my practice is good. Or in 7 years once I don't know, what have you. The best time to start is when you leave right here, whether it's taking the stairs or even starting to think about it. Those are the things we need to start thinking about. I'm also going to leave you with something this morning, and there's going to be more of this afternoon as well. Something called pranayama breathing. Ever hear of it? Okay. You have. Do you practice? Okay, we're going to practice right now. So essentially, when we talk about pranayama breathing, prana is about breath or vital energy. Ayama means control. So essentially, what we're looking at is control of breath. What I'm going to ask you folks to do right now, just practice breathing through your nose, and you're going to expand your ribs as you're breathing. Focus on rib breathing, we'll call it that. Okay? So as you inhale, think about your ribs expanding. Now I'm going to ask you to think about your abdominals expanding. So the ribs don't move. As you breathe in through your nose, let your tummy distend. So contrary to popular belief about having a flat tummy, in this class it's okay. Let your tummy stick out. Think about that. Now what we're going to do is this. We're going to have an affirmation and body scan. So I want you to think about some kind of potential physical injury you may have or physical ailment, whether it's your hip, your back, your knee, your eyelids because you can't keep them open, whatever. You're going to think about that body part, okay? And you're going to scan your body for a minute. And then for another minute, we're going to get you just to focus on your breathing. Just focus on your breathing, and you're going to be thinking as you inhale, exhale, I will be better my back, or my back will be stronger, or that injury or that discomfort will go away. We're going to show you guys the importance of breathing, okay? Just the importance of breathing. So, body scan for 1 minute. Go, please. Close your eyes even. Don't look at me. I'm not that pretty. Okay, so we're going to do a minute of breathing now, focusing on inhaling with the nose, exhale with the mouth. Think about that body part, if you will, and I want you to focus on it getting better, and go. Okay, that was 50 seconds roughly. Think about your scan again. Check your body part. How does that feel? If it feels even marginally better, marginally, that was a minute today. Well, George, that's a mind trick. Exactly. The power of the mind, the power of us to self-heal. Many parts of the world, they don't have access to medication. They focus on self-healing by breathing. They focus on self-healing by reflexology, by techniques thousands of years old. And this is something you guys can start doing on your own. It's simple, folks. We're too rushed all the time in the world. It's an emergency, I have to go and take care of this person. It's an emergency, I have to go to the bathroom. Like, not everything is an emergency. We need to start learning how to slow down. Life will always be there. But if we're not stopping to smell the roses, it's not what we're designed to be doing. I have these two muscle groups up here because they're one of the two of the most misunderstood, in my opinion, and misrepresented when it comes to rehabilitation. So rotator cuff on the left, glute medius on the right. I would say 90% of all the patients I've treated with back pain that's insidious onset, not really sure how it came along, most of them either had weak pelvic floor or weak glute medius muscles. When those muscles can't contribute to hip stabilization, the low back takes over. Low back is not designed to do that. You all of a sudden have back discomfort. We'll talk a little bit more about that this afternoon as well. Any questions, please? Thank you. Thank you very much, Yvonne.